What has COVID-19 taught us about our healthcare system?
I think it's taught us that our healthcare system is really important. All of our PPE and oxygen is kind of widespread, so we kind of need more in each community, and I think it's kind of taken for granted sometimes. But it is shown us the patience and how important it is that we have healthcare for everyone here.
I think we need more people in our long-term care facilities, especially the first wave. We really saw a struggle with that. I think we've definitely done better this second/third time around. Our second wave was kind of small. I think we need some more support for mental health as well. I think we're starting to see where everyone's stuck at home. We don't have a lot of support for mental health. There has been more talks about it, but there could definitely be more for that as well.
It taught us so many things. We should be very careful about our health, and we should also take care, not just us, but to other people as well. We should be very cautious and be vigilant, because we don't want this thing to happen again.
It's essential. I think it's probably underfunded and understaffed, and going forward, not just for pandemics and stuff like this that we're probably going to see in the future, but other issues as well. I think we need to not only thank the people that are in those jobs, but give them more resources and more means available to combat issues like this.
Well, I think it has exposed a lot of weaknesses in the system. Like, I'm a disabled person, and a lot of us who are in the disability community rely on home care. And home care really is a long-term care facility that operates within communities, so it's very exposed. And at times, I know some of my friends lost home care without any notice. And when you depend on it, it becomes very, very difficult. So I think government has learned a lot, and hopefully they'll correct the thing. And some positive things as well have happened. For example, in Nova Scotia, we did not have telemedicine. We have it now. And hopefully that will continue, and especially when you're a person with a disability in the winter. It's difficult to go to a doctor's office, so if you can do it on the phone, let's do it. Continue it on.
I think COVID-19 has shown us what some of us have known for a long time, in that our health system is under strain, and that we need to be serious. If we are actually going to deal with future pandemics, if we're going to deal with increased demand of any kind for healthcare, that we need to get serious about protecting this system that we say we love so much. And actually putting our money where our mouth is and investing in it. She agrees.
I think, if anything, we've all learned that public health across Canada has really come up to the forefront and taken a lead, and even government politically have been following their advice, which is a wise decision.
I would like to see it more reaching, and more people able to get into results, and more not regulated, but to be able to organize it better, but in the way that things would run more smoothly for everybody on both sides, on the health side and on the public side.
We're always understaffed, for sure. Yeah, I've worked in long-term care homes, and they're already understaffed. I already feel terrible for every one of them working there.
I think we really take for granted what the healthcare, like all those professionals do for us, and now that they're kind of our front line and we rely so heavily on them, I think that kind of opens our eyes to that.
That's a tricky question, because I know that a lot of things have been put on pause, unfortunately, and a lot of people haven't been getting necessary treatments because of it, because people are either scared to go to the hospital and get the treatment, or just because, of cancellations, appointments being canceled because they have an influx of people who are coming in that are sick with the virus.
A lot of people were able to get attention, and maybe the only problematic I saw was the cases of people like not being able to, for example, they have heart problems or other type of health problem, and not being able to get taken care because of the hospitals are full. But I still feel like generally, it's pretty good, for at least for the pandemic part,
And that it's not reliable, and it has many issues. But I mean, there was no way to prevent this, I guess. So we're all learning, and maybe next time we'll be ready.
Yeah, I think like the most important thing is that even though the COVID situation is not yet done, we still have to like learn by going and try to like improve it as we're going through the pandemic, because like we're seeing how like the system is lacking already and we have to improve it.
For now, I think it's too early to jump into the lessons learned. I think we'll know in a year like how much this whole pandemic has cost us, not only to the health system but to like the economy in general.
That we are underfunded and understaffed and not set up for a crisis of this proportion.
It taught us that it was vulnerable, very fragile, and that it needs more input, whether it's money or people, human resources. We need to attract more workers there.
But I think everyone else now is really aware of how faulty our system is and how short-staffed we are with nurses and how underpaid they are, and that affects everyone in the city, not just the people that are working in healthcare.
Salaries need to be better, job security needs to be better, and there needs to be a better support network. But that's not to discard all the work that doctors, nurses, and support staff, ambulanciers, that the whole réseau is sort of taken care of.